Hello, my name is Tristan Barber. I'm a doctor working in HIV medicine at the Royal Free Hospital in London, UK. So for HIV, historically we've had daily oral treatment. This has recently been single tablet regimens based on 2 or 3 anti-HIV medicines. We now see there is development of longer acting treatment. At the moment we have available intramuscular injections. This is 2 drugs that can be given every 8 weeks for maintenance of HIV suppression. But we also see the development of longer acting oral treatments, some of which can be given once a week, for example, and some subcutaneous injections which might be able to be given 6 monthly, or can be given 6 monthly in certain situations for people who are highly treatment experienced. But we expect to see the development of more long-acting treatments, both orally and by injection. The ideal, in reported data from patients, is that they would prefer a 6-monthly injection with a whole combination being given twice a year, or a once-weekly tablet over daily oral therapy. So I really believe we'll continue to see development of longer-acting regimens that are complete, that can be given at longer dosing intervals, either by simple injection or perhaps longer acting oral preparations as well. There has been the suggestion that there might be the development of longer acting treatments given by other mechanisms such as implants under the skin or residence devices that sit inside your stomach. But I think those are some way off of development, and it's more likely we'll see a long acting tablet or longer acting injections both under the skin or into a muscle before we see those. HIV treatment is treatment for life. Many people can feel stigmatised by daily oral treatment, or it can be a reminder of living with HIV. They also worry that other people might find their tablets and therefore they would have no control over who finds out about their HIV status. Some of the benefits about longer acting treatment are that people don't have that daily reminder of their HIV status. It's also more difficult to forget or miss treatments. So people sometimes miss daily oral therapy, whereas with longer acting therapy it may be easier for them to attend their appointments or to remember to take their treatment. Also, there may be fewer interactions with other prescribed medicines, and there's less of the fear of revealing your status. So it may mean that people, from a psychological point of view, feel more free of previous trauma related to HIV, including sometimes how they acquired their HIV infection. I've had people for whom taking longer acting treatment means that they're able to start having relationships again. They're able to start to enjoy their sex life again because they're not constantly worried about HIV disclosure inadvertently or having to remember to take their HIV treatment daily. Also, they can travel without remembering to take packets of pills or bottles of pills that they need to take daily. So this can reduce treatment-related anxiety. The most important challenge remains global access. We know that when new developments happen in HIV, whether it's new drugs or new methods of giving drugs, these tend to be targeted at the most well-resourced countries first. So what we really need to focus on is global rollout, better pricing for more affordability in different country and socio-economic settings, and greater equity of access. We also need to learn new lessons. So whilst we might know about what to do if someone misses 1 or 2 days of daily oral treatment, we're still learning lessons about what we need to do if someone misses their weekly tablet, or if they're late for their 6 monthly injection, for example. And in addition, we need to learn more about drug-drug interactions with these new methods of administering HIV treatment. So we need to better understand what drugs might interact with these longer-acting treatments and how that might have an effect. The latest developments in long-acting treatment really relate to longer-acting oral therapies. We're starting to see good data on a combination of 2 medicines that can be given as a once-weekly treatment. When I first heard about this, I wasn't sure if it would be of benefit to patients, but in fact I've spoken to 2 community organisations in the last couple of months and asked the audience what they thought about a weekly tablet. 90% of them said this would be ideal for them. They would set an alarm on their phones to remember to take it, and they said they would much prefer it because it's self-directed over and above having to come to the clinic for injections on a more regular basis.